breaking news, new numbers from Johns Hopkins put U.S. deaths at 970, and that's just today, and today is not over. This is the same day, as we mentioned at the top of the program, that President Trump said different words on the pandemic, trying for a moment to strike a more serious, somber note. And while the president did admit the pandemic will probably get worse before it gets better, and it's getting worse right now, by the end of the roughly 26-minute news conference, he had fallen back on an old line that the virus, quote, will disappear, unquote, despite the rising cases. That kind of dismissive and downplaying language is why we want to do now what we try to do as often as possible, get the reality from the front line so you can see and hear from people who face this virus each and every day. Joining me now is Dr. Frank Lavecchio, an emergency room physician and professor at the University of Arizona College of Medicine. First of all, doctor, thank you for what you're doing. You work at a few different hospitals in the Phoenix area. Describe what it's been like.
In a word, it's been nuts. It's been pandemonium. There's people all over. We're waiting for beds. There's some people that are waiting 3 days in my emergency department, waiting for a critical care or ICU bed. I think 4 out of 5 patients are there for COVID or COVID-19 complaints. It's very, very troubling. It's something we've never seen before. My staff is starting to get sick. It's not uncommon for nurses to call in sick because they are sick. My phlebotomists, my techs, half of our tech staff is out at one of the hospitals. Morale sucks because, people are getting sick. And then we hear stuff around us where people still don't believe this is happening.
It's happening, and I know it's happening around you each and every day. What about testing? The president, even tonight, bragging that the U.S. has more testing than any country in the world. What's your own experience with testing?
Well, we're a big country. We make up, 5% of the population, but right now we have 25% of all the cases worldwide. I think we might be doing a lot of testing, but in my experience, people are waiting forever for testing. I had 2 deaths the other day where I did not test them. I chose not to test them because we had to ration our nasal swabs. We had to ration our nasal swabs. I couldn't use them on them. I chose to use them on somebody that was maybe more stable, where it would make a difference. And both those patients died within a few hours of the emergency department. They're probably not going to be counted as a COVID death. And we saw that from other reports today that the number of deaths and number of illnesses are actually underreported, contrary to what a lot of people have been saying.
So just repeat that one more time. You can't test everyone that you want to test, and you had to basically not test 2 people that you were convinced had it, 2 people because you didn't think it was going to make a difference on whether they lived or died?
That's absolutely correct. And it wasn't just me alone. It was like a collective decision. I was just like, hey, should I do a nasal swab on them? I was like, what are you kidding? You have to do it on somebody else. Every day is like Groundhog's Day. You walk in one day, they're out of nasal swabs. Another day, we're out of reagent. Another day, we're sending it out to a lab. And when you send it out to labs, that adds to it. Some people are discharged from the hospital before you even know if they were, quote, positive or not. The good thing is we learned from Italy and New York, and we kind of see the signs and symptoms that are consistent with COVID-19. But, the tests we're not getting. And we know the tests are not super accurate anyway.
What do you need?
It really sucks.
What do you need, and who do you need it from tonight?
Well, I'm jealous of my New York friends that had FEMA come, the National Guard. They were checking people outside. I tell them that, I have people with coughs and a little bit of pneumonia that I'm going to send home. And they're like, what are you doing? How is that patient making it back to your emergency department? You need to triage those patients out. You need people out front telling them, to go elsewhere or to, just treat them a little bit and tell them what's going to be offered to them and then let them go. I think that's one thing. We need to get treatment that's fast and quick. And we need to listen to doctors and healthcare providers with medical advice. This is a moving subject. Things are going to change. Whatever I said in the last 4 or 5 months, some of that is going to be wrong. And let the science dictate what's happening here. Just, try to listen to us. If you're going to wear masks, realize that masks cut transmission by about 40%. Our best 2 drugs out there, maybe remdesivir and dexamethasone, they cut it by 10%. You have a drug out there that decreases 4 times better than any drug that we have, namely a mask. Just wear a mask. You know what I have to go through at work? My face comes out, it looks like a monster when I take off my mask. But I wish it was tighter. I wish I had more PPE on me. I wish I could have a spacesuit. and people just get stressed over wearing a little bit of cloth on their face. It just seems like such a ridiculous paradigm.
I know this is hard on you, and I know it's hard on your colleagues. And again, we want to thank you for the work you're doing. We heard the president speak today, and he said different words out loud than he has said in the past. And we know he watches cable. So if you had a chance to speak to him now and give him advice, what would you say?
I would say that, you know, I understand your concern, and please kind of let the medical professionals, you know, talk about this. You know, you got to let them speak about this and just kind of take the back of this and just kind of say, hey, my advisors say X, Y, and Z. I don't know why there's, you know, Fauci is not there. I mean, Fauci is a god in the infectious disease world. Fauci wrote the book on infectious disease and internal medicine. You know, we love him, and to dispute things against him, you know, it's rough. Very, very conservative guy. You know, I would listen to the medical professionals is what I would tell him.
Dr. Frank LaVecchia, once again, thank you for what you're doing. Please get whatever rest you can because we need you there.
I appreciate it. Thank you so much. Thanks for all you do.
All right, still to come.